Hello, my name's James Titcombe. I work for CQC as an advisor in patient safety, and I'm here today to talk to CQC's 3 chief inspectors. So I just want to move on to a really important subject now, and this is one I care about. How many times do we hear about whistleblowers who staff themselves who raise concerns and they treat it in an appalling way? I mean, there's been report after report. What are we going to do to protect whistleblowers who do raise concerns about bad services?
I think the first thing we've got to do is listen to the whistleblowers and make sure that we're acting on what we hear. And I think we must, of course, make sure that whistleblowers are protected, but I think if we can also demonstrate that things happen as a result of whistleblowing, that in itself will change the culture on whistleblowing.
It's about people feeling confident to be able to raise those concerns and also us demonstrating that we do something with them. What I think we need to be encouraging, though, is not just for people to wait until, the Care Quality Commission pitches up on an inspection, but actually that we're expecting organisations to have a culture and an atmosphere where people can raise their concerns, be heard, and a difference being made without them feeling as if they've been victimised. So again, I think that's one of the things that we need to be looking at, particularly when we're asking the question about are services well led. So how do services encourage their staff to make suggestions and contributions? How do they respond when concerns are raised? And what kind of evidence have we got to see that there's a difference has been made?
Which brings me very nicely to this question from Derek Medhurst, which is, how are we going to assess the overall leadership in the relevant organisation?
The staff surveys have questions in them that really can point to whether the organisation is being well led. I suppose one question is the question about whether you would want to be treated in the place yourself or want a member of your family to be treated there. But we can also look at staff sickness levels and things like that. But that's even before we get on site. But when we go on site, we're going to be talking to a whole lot of different people. We're going to be talking to the leaders, interviewing them individually, and actually finding out how they assure themselves about the quality and safety of services. But we will also be talking to other staff, to junior doctors, senior doctors, nurses, allied health professionals. And you then get an impression from that about leadership at all levels. It's not just at the trust board level, it's at the clinical directorate level and it's at the ward level. And I think a well-led trust is one that's well-led at all of those levels.
Question from Paul Thackeray. Paul says that he's read a number of CQC reports and they come across as bureaucratic and don't tell you enough about what's actually happening or what it's like to be cared for. So what's your view on that, and is there anything we can do?
Now, I'm not saying that we're going to get those right to begin with, but we will try and we will want feedback on them. What we're trying to do there is, first of all, to give a very concise summary at the front so that people who've really only got a couple of minutes or 3 or 4 minutes can read that and get an idea of what we thought of that trust when we went in. So I hope there will be a 4 to 6 page summary that will be quite easy to read. From 2014 onwards, we're also going to be giving ratings. And I think the ratings will also be a very quick way for people to look at it, and we'll be giving ratings not just to the hospital as a whole, but also to the services, because if you're going to have a baby, what you're probably interested in is the maternity service. If you're got a frail elderly parent, you probably want to know about the frail elderly wards. So I think those ratings, they're going to be very testing for us to get right, but I think they will also make the reports very readable.
In terms of the readability of the reports, are we going to get feedback from members of the public?
We will be looking for feedback, but I'm sure we'll get it anyway. And so I'm relatively confident that we'll get that feedback.
The last question was a really good one. I've been impressed, having met with Ofsted, about how they write to pupils in a way that pupils, whether they're junior school or senior pupils, can understand, having had a visit from Ofsted. And what I'm committed to doing is writing an open letter whenever we've been into a surgery alongside the report, which the practice would publish on their website and would be given to the local press about what's good and what might be needed to improve, alongside eventually the ratings that we'll publish. What you find with general medical practice is that they can be really, really good at looking after elderly patients, but they might not be good at looking after the homeless or very vulnerable people. And I think stating that will help the professionals, the doctors and the nurses, to try and up their game. So this is about not just ensuring safe practice, but trying to get everybody on the journey for improvement.
Okay, well, thank you very much for answering our viewers' questions, and thank you very much for watching.